Hi, my name is Jeremy Cordingley. I'm one of the intensive care consultants, and over the next few minutes I'm going to take you through some of the important features of the pacing box that we use to manage temporary pacing, mainly after cardiac surgery. The purpose of this talk is really just to give you a brief introduction to the pacemaker, how to switch it on, how to switch it off, what the major functions are. It's certainly not to make you an expert in managing the pacemaker, and we'd expect you to ask for advice if you need to make any changes to patient settings. Okay, we'll start with connecting the box to the patient. And so we'll first consider patients coming back from cardiac surgery. Some of these patients may be connected to a pacing box already, but if they're not, they will normally come back with pacing wires coming out from their chest. Sometimes that's two separate wires, but nearly always it's one wire which has four different components to it, a so-called quad wire. And they will normally have two white wires and two blue wires. The two blue wires are the atrial wires, and the two white wires are the ventricular wires. And we remember that by saying VW, so that's white is the ventricular wire. So that's how we remember which leads are which. If there are two sets of leads coming out, or only one set of lead, then the position usually gives away where the origin of the lead is. So if they're atrial leads, they usually come from the right side of the sternum, patient's right. And if they're ventricular leads, they will normally come out on the left side of the sternum, patient's left. And they will not necessarily be color-coded. It's the quad wires that are color-coded. The pacing wires will be connected to a pacing lead, and I've got an example of one of those here. This is a pacing lead. So the pacing wires will be connected to one end of those, so they're just literally put in and screwed up tight. And the other end of the pacing lead will have two terminals on it, a red and a black terminal. And this is what you will need to use to connect the pacing wire to the pacing box. So this is the OSYPKA pacing box. This is the model 203H. And we're going to look at some of the main features of this box. First of all, connecting the box to the patient. So if we have a look at the top end of the OSYPKA pacing box, you can see that there are four terminals, and these are coloured red and black. There's two sets of each. One comes out of an area of the box which is white and labelled V, and one comes out of an area of the box which is blue and labelled A. And these are the terminals that we can connect our pacing lead to. So that's very straightforward. It's a matter of unscrewing the terminals for whichever lead that you want to connect, and then placing the leads in, and then screwing up the sockets like that, nice and tight so they don't fall out. Remember to get them the right way round. In other words, the ventricular wires must be in the white side and the atrial leads in the blue side. If you get them the wrong way round, obviously the pacing is going to work in a reverse direction. It doesn't matter whether you put the black and the red into the wrong sockets. Okay, it will work either way round. Okay, next we get to the front of the pacing box and the controls, and this box is organised in a very logical way. So I think the place to start is how to switch it on. On the bottom of the box is the on switch. Press the on switch and lights will come on, and after a few seconds the whole box will light up and you'll be in a position to make some adjustments. The next important button is the yellow button. This is the unlock button, and you need to press that to enable yourself to make changes to the settings on the box. If that button, if you're using the box and you don't press any buttons, after 30 seconds the box will lock and you'll have to press the yellow button again. So we'll press that now, and that will then show us the settings that the pacing box is set to. So if we work our way down the controls on the right hand side of the pacing box, what we can see first of all is the big blue knob at the top is the rate button that controls the rate the pacemaker is set at. The next two blue buttons, the darker blue buttons, are the atrial control buttons, and these control both the atrial sensing, that's the little button, and the atrial output, that is the big button. And you can see that helpfully the settings that they're set on are displayed adjacent to the buttons on the display. The next button as we move down through the heart is the AV delay button. That's the light blue button. And the bottom two controls here are the ventricular output, that's the large button, and the ventricular sensing is the smaller button there. So these are the main controls that you will need to adjust. So on the display we have at the top the mode of the pacemaker is set on with 3 letters on. Remember, that's the first letter applies to the chamber of the heart that's being paced, the second letter to the chamber of the heart that's being sensed, and the third letter signifies what happens when sensing occurs. Okay, next to the indicator for mode button is the battery indicator button. This is also one to keep a close eye on, because if you've got a patient who's completely pacing dependent, it's really important that we notice when the battery is about to run out, and we obviously need to be able to change the battery at that point, which is very straightforward in this box. And then moving down the indicators, we have the heart rate, and then the atrial sensing and output, the AV delay, and the ventricular sensing and output. Okay, the next important button on the front of the pacemaker is this red button. That's the emergency pacing button, and what that does is it switches the pacemaker to a non-sensing mode, and it puts up the output to maximum to hopefully overcome any problems with connectivity with the patient. So by pressing that, it goes up to 18 on both the atria and the ventricular outputs. At the bottom of the indicator panel are a whole series of indicators that allow you to change the mode of the pacemaker by pushing on one of the buttons on the right hand side, and they also allow access to a menu which includes further functions within the pacemaker. And then finally there is an off button at the base here which allows you to switch the pacemaker off. When you do that, it gives you the option of storing the settings that the pacemaker is set on, or clearing those completely. Sorry, one other button I should have mentioned is the pause button, which allows you to temporarily pause the pacemaker, and we normally would do that so that we can assess the underlying rhythm of the patient for a few seconds, and then by releasing it, the pacemaker will go back to its normal function. Okay, in order to change the battery, you need to turn the pacemaker over. The pacemaker has a little battery compartment on the bottom of it, and you can access the control for opening that by sliding this little tab across, and you press the button, the door will open and the battery will fall out. Notice that the pacemaker carries on working even when the battery is out, and you have about 30 seconds to put a new battery back in. It doesn't actually matter which way round you put the battery in, but just make sure that you've taken the wrapping off it before you reinsert it and close the base of the pacemaker. So that is really very straightforward. The important thing though is to notice that the battery needs changing. So over the last few minutes we've covered how to connect the pacemaker to a patient, how to switch it on and off, how to pause it so we can assess the underlying rhythm, and how to change the battery. Thank you for looking, and I welcome you to Barts Hospital.